It's just gone 8 minutes past 8. Welcome to the second hour of Inside Eyewitness News. My name is Mahlatse Mahlase. We are live on Radio 702 and Cape Talk. And of course, in this special hour, we are also live on EWN's Facebook page in case you want to see all of us. We are in this hour usually taking a topical issue and bringing on experts to have a discussion with them. And tonight we're talking alcohol, and we are asking, do we need more laws to regulate our bad drinking habits? There is no question that we have an alcohol usage crisis in our country. Stats tell us that just over 60% of South Africans do not drink, but alcohol is a major contributor to the carnage on our roads, the trauma cases at our hospitals, and interpersonal violence. According to Transport Minister Fikile Mbalula, research conducted by the Road Traffic Management Corporation in collaboration with the South African Medical Research Council and UNISA shows that driver alcohol intoxication accounts for 27.1% of fatal crashes in the country. And that is costing us 18.2 billion annually. And then, of course, COVID-19 happened and we had the alcohol ban. That ban, imposed by government in an effort to contain the spread of the deadly disease, gave us a glimpse of what could happen with limited alcohol sales. We saw trauma cases drop and, of course, fewer accidents, and the death toll decreased, begging the question, do we need more stringent rules to regulate our drinking? For this discussion, I'm going to be joined by Advocate Makhosini Msibi, who is the CEO of the Road Traffic Management Corporation. We also have Kurt Moore, who is the CEO of the South African Liquor Brand Owners Association, and Dr. Malebo Mashaba, who is a clinical psychologist. She's also the managing director of Mashaba Wellness Consultancy, and she specializes in alcohol and drug rehabilitation. Of course, we'd like to hear from you in this hour, so you can SMS us on 31702 or 31567. You can also email us at inside@ewn.co.za. If you want to give us a call, our number is 011-883-0702 in Gauteng, and in the Western Cape is 021-446-0567. Dr. Mashaba, I'm going to start with you. I guess it is correct to say South Africans have normalized alcohol. Actually, it's quite central to all of our social gatherings, whether it's funerals, there's an after tears, and alcohol is a part of it, or you go to weddings or celebrations, alcohol is there. And is that the reason why we have such a crisis in our country?
Hi, Mahlatse. Thank you also to the listeners and the viewers at home. Yes, indeed, we have seen, especially now with COVID-19, that we have had a severe crisis concerning alcohol. And the major thing that has been a result of this is that we, as a society, we have a lot of binge drinkers. And we've seen that people are unable to stick to what will regard as a healthy drinking habit. So we have had a lot of binge drinking, and as a result, it becomes uncontrollable because a lot of binge drinkers, because of some underlying psychosocial factors that have been there even before COVID-19 in our society. So alcohol, we might regard it normally in South Africa that it's a normal thing. You know, people do not see anything wrong with drinking that much. But we have seen now with COVID-19 that we've had a lot of cases, especially in that involve trauma, as a result impacting our hospitals and so on. So I think it's very important that we look at the concept of binge drinking. Because it's a process
what is binge drinking? I mean, when do we define that now we are going over the limit?
Binge drinking involves taking in a specific amount of alcohol within a short space of time. Like briefly we say, one consumes an excessive amount of alcohol in a short space of time. When you compare it to a person drinking daily, which we consider that is less severe, if a person drinks daily, but with lower limits, we say that it's manageable. But when you binge drink, it means you drink more than enough. For example, we'll say if you drink more than 5, let's say cans of alcohol within 2 hours, we get that as binge drinking. And as a result, people binge drink mostly as a sign of wanting to numb a certain emotion or a certain event, or trying to cope with a certain incident. But for example, individuals who binge drink are likely to develop a high tolerance of alcohol, finding themselves needing more and more alcohol to feel intoxicated, meaning that the lesser they drink, they don't get drunk anymore. You know, we have this thing that the more your blood system gets used to alcohol, you find yourself being able to tolerate a certain level of alcohol. Hence, you have the desire to drink even more in order to reach that level of intoxication. Hence, we start having people who would normally diagnose as they are binge drinkers. And also,
so maybe just to step in there, because a lot of our time, our excessive drinking, when we look back to our apartheid era, we were told that things like the DOP system, where employers used to pay employees with cheap alcohol, is part of the reason for excessive drinking. What are the drivers of excessive drinking now in democratic South Africa?
Besides the doping, and also I've seen that also research has supported the migrant labor system. Also, that has been affecting a major number of our population in South Africa. There's also psychosocial factors that causes binge drinking. Like we mentioned our problems that take place within marital problems, relational or interpersonal problems, poverty in our country, and increased level of psychiatric conditions like your depression, your anxiety, and also a lack of social and recreational opportunities, because as human beings have an esteemed level to self-actualize, to have a sense of responsibility. So once, because there's that competition in society, once you are unable to accomplish that or to achieve a certain level in life, hence having a lack of social opportunities, we find that a lot of people go on binge drinking as a way of numbing, like I said previously, negative events, negative emotions, or whatever kind of a problem that one might be going through. And also, I think that has been a result of a lot of unregulated outlets that we have in our communities, because that's where most of the alcohol gets sold. And, you know, there's no regulation in terms of the age, who can buy alcohol, who can purchase alcohol and not. We find that is where each and every person, is irrespective of their age, they're able to access whatever amount of alcohol they want to purchase. And also we've seen binge drinking being one of the causes of alcohol-related mortality and morbidity in our country. And that has been the most emanating factor, I think, even during COVID-19, because we've seen with our hospital reporting overburdened in the trauma units as a result of such cases, as a result of alcohol.
Let me bring in Advocate Msibi there. And when we started, I quoted that research that was done by the Road Traffic Management Corporation, the South African Medical Research Council, and UNISA. And those figures are quite scary. 27.1% of fatal crashes in the country linked to alcohol.
Good evening, Mahlatse. It is quite a sad story and a sad revelation that in terms of the research that we have made, we had discovered the impact of alcohol into the fatal crashes, which invariably cost the economy about 18.2 billion annually. It's quite a significant number, over and above the strain that it brings into the health system. We have witnessed, even during the COVID-19 process, when we were at various stages, be it lockdown level 5 and 4 and 3, when liquor was, of course, a taboo and it wasn't allowed to be sold, we had a sigh of relief because the accidents that we have had and the crashes that we had reduced quite significantly. But also, we had an opportunity to see when liquor was also allowed to be sold before the other lockdown, we realized the sharp increase of the accident and the fatalities. It has now buttressed the research that we have made. This provided us with an empirical evidence that liquor is a major role player in terms of the fatalities. As we have said that about 27.2% of our fatal crashes are consequent to the consumption of liquor.
But we also know, apart from those behind the wheels, but pedestrians are also, they constitute quite a high number of people that die on our roads because of alcohol.
Well, there are two scenarios. In terms of the study, a drunken driver behind the steering wheel, there is a high likelihood that three pedestrians will be knocked down by the vehicle. At the very same time, those who are jaywalking, those that drink and get into the streets are also a high contributory element. Remember, if you take the statistics, you will then realize that pedestrians contribute significantly into the fatalities, which of course, when you diagnose it further, it's not just mere pedestrians. These are pedestrians mostly who are under the influence of liquor. So it takes two to tango, both drivers as well as pedestrians who are under the influence of liquor poses a very serious problem to both the road user, other road users, as well as to the fatalities.
Thank you very much there, Advocate Msibi. I'll bring you in, Kurt Moore. I'm sure you would not disagree with any of these figures that have been quoted just in terms of the impact of alcohol usage in our country, even as the industry.
Good evening, Mahlatse, and thank you for having me on your show. Yeah, we don't dispute those figures quoted by Mr. Msibi or by Advocate Msibi. Indeed, we are of the view as industry that in terms of drinking and driving, as well as drinking and walking, that we should have a zero tolerance approach to those issues. And what is zero tolerance, you may ask? Zero tolerance in our view is we need to crack down very hard on those who break the law. If you're driving under the influence, then you should be arrested, you should be tried as soon as possible, and you should be punished. And similarly with people who walk on the streets, I think under the influence, I think it's in Gauteng where the figures is something like 35 to 40% of the fatalities are people who drink and walk. So we need to see a zero tolerance. Now there's been lots of discussions and we're taking note of the Minister of Transport's plans to reduce the blood alcohol content level from its current 0.05 down to 0. In our view, whether or not it's at 0.05, and there are many countries that are on 0.05, countries such as Argentina, Australia, Austria, Belgium, Finland, Switzerland, or down to 0.2 or even 0. I think there are a few countries on 0, such as Czech Republic, although they're revisiting that right now. But whatever the limit is, you have to be able to take very firm actions against those who break the law.
I think good way to get into this conversation. If you're just joining us, it's just gone 23 minutes past 8. It's the second hour of Inside Eyewitness News. We are live on Radio 702 and also on Cape Talk. And if you want to see us, we are on EWN's Facebook page. And to bring in Mr. Msibi there, obviously, Kurt was saying that they note the government's intention to then have a 0% alcohol limit for all motorists. And he's asking a very critical question there, is that do we actually need this new law when we are not able to actually police the current limits?
Mahlatse, it's quite a number of factors and a number of permutations. When the minister was talking about the issue of having a 0 level of alcohol within your blood content, that goes hand in glove with the initiatives that we are taking to deal with the issue of the reclassification of the road traffic offenses. You will know at this current moment, if you are then arrested for drunken driving or even for reckless driving, you will then, in terms of drunken driving, you will be allowed the 4 hours, which naturally will then make you to be eligible to bail. But you are eligible to bail in terms of Section 59 of the criminal procedure, which is not a tedious process and which is not a deterrent in any other way. Our view is the drunken driving, it's equivalent to a Schedule 5 or Schedule 6, be it murder or premeditated murder. So the measures that needs to be applicable should also be in terms of Section 60 of the criminal procedure. We are one of those countries that cherishes the constitutional and the Bill of Rights. We are not saying people should not be eligible to bail. However, what we're putting forth is the fact that it should be a very tedious process for you to get bail in the same way as it is tedious for somebody who's charged of murder.
So I just want some clarity there, and maybe use this opportunity to invite our listeners who want to participate in this conversation. I mean, if they think there needs to be a 0% alcohol ban when driving, they can call us on 011-883-0702 or 021-446-0563. Advocate Msibi, are you saying that the current process where you go to a police cell, you are there for 4 hours, and then you're given bail should be should now be disregarded, but instead you must stay in the police cells until Monday to actually appear before court?
That's what we are espousing, simply because you need to have some deterrent measures, not to make it easy. For now, it is inviting to drive under the influence of liquor because the seriousness that is attached to the offense is not felt by the perpetrator. We'll make a typical example. We have a number of cases where a person under the influence, driving under the influence of liquor. Just last week, we lost 3 law enforcers through a person who has been under the influence of liquor. Had that person not died within the scene, he would, if he had means, he would then have briefed an attorney or an advocate, and within 4 hours, he would have been eligible for bail. Yet, he has taken lives away. And this is the point that you're saying. We need to tighten the law enforcement arm. It is not only sufficient that we have law enforcers that will arrest, and they arrest immediately on the left-hand side. The police, as well as the justice system, allows you within a short space of time to be admitted or to be given bail. We're beginning to say if the country is to be serious about the nature of the offense of drunken driving, Let's then begin to deal with the amendment and the reclassification of the offenses. Let's make it very difficult for you to get bail. But at the very same time, we're also then espousing and, of course, mobilizing very vigilantly for a mandatory sentences of not less than 2 years if you are then convicted for drunken driving. That on its own will then begin to deal with the propensity of committing an offense.
Of course, the one question I want to ask after this ad break is, are we actually arresting those that are violating the rules currently? Because we can come up with new regulations, but if the law enforcement is not there, how is that going to be a deterrent? But we'll continue this conversation after this break.
Prepare for the week to come. Inside EWN on 702.
Of course, earlier on, we were hearing from Advocate Makhosini Msibi, who's saying, apart from saying that they want a 0% alcohol limit for all motorists, they also wanted to make it difficult for you to get bail if you're caught drunk driving, if you're caught drunk driving. And Nico here, though, Nico, you are on the line from Orlando East, and you're saying that we should also talk policing.
I thought, your question was not answered there by Advocate Msibi. You asked me a question, is there anyone monitoring that these laws are being followed up? If I heard correctly, I think that question, he still didn't answer it. And he gave you a very, very long answer. Look, it's happening already in the street here. People are drunk and, but no policing on the road.
Yeah, and just to throw it back at you, Advocate Makhosini Msibi, one of the challenges that we do have is that we've got quite a fragmented transport regulations. If you look at it in the cities or in the metros, you've got the metro that can work at night and actually police the streets. But when you go to other municipalities, you actually don't have anybody working in the night to monitor that we don't have drunk drivers in the street. So again, we can change the laws, but are we actually policing? Advocate Msibi? It looks like we've lost Advocate Msibi there. And just to bring you in, Kurt, because you actually said that the issue here is actually law enforcement. Do you think that we are responding adequately enough?
Mahlatse, I think that, as Advocate Msibi said, it needs a holistic approach, because this is about the police and policing on our streets, but also through to the criminal justice system. And as Advocate Msibi said, you need to tighten up those procedures so that people who are found drinking and driving are expedited through the system. They are afforded an opportunity to have their blood tested, and they have a speedy trial, and they face the consequences of their actions. Now, as industry, we want to work, and we are working with the Road Traffic Management Corporation to assist at a more practical level, looking at alcohol evidence centers, so that we can help expedite those that testing. I think many people don't think, as Advocate Msibi said, don't think it's that serious a crime. But more importantly, they don't believe that they could potentially be caught and arrested and face the consequences. And you need to up your game there in terms of apprehending people and taking them through the criminal justice system and having harsh punishment for them, because that also acts as a deterrent for others who are contemplating or ignoring the law.
Yeah, but as an industry, though, obviously, are you saying that we need this law, or are you saying that we just need to be enforcing the current ones we
have? I'm saying, as I said up front, we're saying zero tolerance. Now, and government, as I said, has tabled an option to reduce the blood alcohol content to zero. We actually, as the industry, we're not objecting to that position. But we're saying whether it's, as I said earlier, 0.5, 0.2 or zero we have to enforce the laws properly, because ultimately we'll look back after a few years and say, well, we still haven't made any changes to the carnage that's happening on our roads. And we've been out in public saying we will support the whole concept of zero tolerance. No, if you're going to drink, do not drive.
That's all very well, but if you look at South Africa currently, I mean, we don't have a public transport system in the evening. So is it realistic to actually say that we will have motorists who have not had a single alcohol in their system driving?
Yeah, look, the complexity around 0%, I watched TV the other evening, and, there were all those issues about if you've had cough mixture, you could be arrested, etc. But, if you go back to the transport situation, yes, we do not have first world transport systems in South Africa. You can't go out partying till 2 o'clock and rely on public transport. But we've got to start helping people change the mindset. And that changing of the mindset, we have Uber these days. So, try and use Uber. Some places don't necessarily have Uber, but issues such as designated driver. Ask a friend to drive, and for that evening, he doesn't have any alcohol, and he's the designated driver, or she's the designated driver for the evening, so that we all get home safely. Because, as you rightfully said, Mahlatse, we do struggle in terms of our transport options for those people who go out late at night. But if you think of the consequences of your actions, surely just trying to get an Uber home, or having a friend who's not consuming alcohol for that particular evening drive the car.
Dr. Mashaba, is this enough to try and respond to the crisis in our country?
Mahlatse, the issue of social responsibility, yes, is of importance. In that in that people need to take responsibility, in that they consider other people's life, not to endanger other people's lives, and also to show care towards the others, that if I'm drunk, I need to go home and rest, or whatever preventative measure that will make sure that everyone is safe. But at the same time, I feel that this is not enough. The coming of the regulations at the moment, for me, it's more of an emergency response because of what has been happening now and being exposed by COVID-19. Because when you look at the issue of alcohol abuse, it also borders on the health as well as the social ministry. So as a result, the government's approach is more punitive rather than preventative, because now here it is. We can prosecute them, and then they get jailed for drinking and driving. But what about the root causes? Because now we need to go deep and find out what predisposes people from our societies to abusing alcohol to such a level. Because it is only when we go down to the ground to find out what seems to be the problem. And these are social issues. What happens on the ground? Why are people binge drinking? Then it will assist us if we have a comprehensive understanding of all the dynamics that people are exposed to on a daily basis, and to come up with programs on that level to try and help people who are struggling with alcohol. Because now we can say the focus now, because I've seen from the engagement, the discussion is mostly on people who drink and then get behind the wheel. So because this is a punitive measure that is being applied at the moment, how about, because people can always find a way to adapt to new rules and laws that are being passed by the government. Some people might decide we're going to drink, and after drinking, they will not even get behind the wheel. But then also there are still consequences. Yes, they will not get behind the wheel, meaning we can have a lesser cases of accidents, for example. But then if they drink, and if they still drink and remain at home, it means also we're going to have an increased cases of gender-based violence, for example, assault cases. So they are still going to increase. So for me, this approach, it doesn't have to go in this fashion, because like I said, it's more punitive. And I think a punitive approach has never worked because it's not actually to correct. Yes, we say it's when we punish them, it's to correct their behavior. But then what about the root cause of abusing alcohol?
Yeah, it looks like what we are proposing ignores those root causes. And just looking at comments that we are getting, especially on our Facebook page, a lot of people saying that there is no law enforcement. Cindy Lee Gibson saying it's law enforcement in this country is a joke. They don't abide by the rules of the road themselves. And then we've got Zakona Mutwa Ngasana, who's also saying, I think they should give people jobs like more police and traffic officers and just leave alcohol. We also now have a call from Michael in Randburg, and you are also saying that the laws that they're proposing are just too harsh.
Hey, Mahlatse, afternoon.
Yes,
Good evening, rather.
You're saying the laws are harsh?
Yeah, no, I think it's a bit harsh. I mean, like the whole country has turned its back, like alcohol is this devil that's causing all the chaos in our country. Number one, I'd be just short and sweet. If our Metro Police was to start doing their job instead of taking bribes, I think we'll get somewhere, because right now I can afford to drive under the influence if I've got 1,000 in my pocket. And then few meters I'll cause a hectic accident. So now I think we need more policing. As you've said, they must hire more people to do the job, because now honestly, it's a bit unfair to say now, oh, they were complaining about our hospitals were full due to the drunken people. Are the hospitals empty now? Because
that's a good question, Michael. And obviously, we can't ban alcohol sales forever. And I see Leonard McKay on Facebook is also disagreeing with you, saying human behavior is behind the abuse of alcohol and not the laws themselves. Mpo from Zanin, you disagree that alcohol. You disagree in saying that alcohol brings misery into our homes, and we should have stricter laws.
Hi. Surely your guest can convince me with regard to the abuse, according to her statement of the usage of alcohol. Because surely I've seen people who drink responsibly. Hello?
Yes, I'm listening to you, Mpo. You're saying people that drink responsibly?
Yeah, there are those people who drink responsibly, and the matter of GBH, grievous bodily harm, or the so-called nightmares between the people who drink from the morning, early hours of the morning till tomorrow, early hours of the morning of the next day. It is never started because of the COVID-19. So the guests must know that in this period, I hate to use the
we're losing you there, Mpo. Sorry. Unfortunately, we can't continue with that call because we are losing you there. But Kurt, what else? I mean, Dr. Mashaba there speaks to, we can't do this Band-Aid approach to dealing with this crisis. In terms of the industry itself, what are you doing to ensure that we have more healthier relationship with alcohol?
Mahlatse, I believe that we need to have an all-of-society approach. I don't think it's only government's problem. I don't think it's only the industry's problem, nor is it society and the consumer's problem. We need to have, as I said, an all-of-society approach where we look at our relationship with alcohol. And yes, the industry has got a role to play in that situation. What we're trying to do right now, as industry, we're focusing on a few areas. We want to focus and working with government, as I mentioned, some of the issues that we're busy with RTMC on drinking and driving. Binge drinking is also a program that will require some focus, and then underage drinking. And we also want to work with government and partner with government and civil society in addressing the issue of gender-based violence, because it is a problem that requires some addressing. And one of our members has launched a gender-based violence WhatsApp helpline, through which and they try and raise social awareness. It's called the No Excuse campaign, and it provides a reporting platform, a safe reporting platform for anyone who's a victim of GBV, and providing a referral to counseling support services.
So, but a lot of the interventions that you're talking about don't seem to address what Dr. Mashaba was also speaking to, just in terms of behavior, you know, and also she talked about people that are selling alcohol to young kids. Are you having conversations with some in the industry around responsibility and making sure that you don't have those that are underage also accessing the alcohol?
Absolutely. I mean, we're having discussions with the retailers to deal with those issues. Nobody should be serving alcohol to underage children who are under the age of 18. You shouldn't be selling alcohol to anybody who's already intoxicated. We're in discussions with the retailers to see how we can work on an ID verification system, so that before we sell alcohol, we ask for IDs. So those are all programs that we're currently in discussion with the retailers. Now, what Dr. Mashaba also spoke of is the number of unlicensed and unregulated outlets. And I think that's where we need to work more closely with government and with law enforcement to try and close those opportunities for illegal operations. As manufacturers, we by law not allowed to deal with those businesses, because we can only, according to our license conditions, sell to licensed businesses. So we don't have direct contact with them. But I think we need to have a look at how we deal with the whole issue of unlicensed outlets, and either bringing them into the regulation, perhaps not all of them, but also try and help to find some other ways to help develop the township economy, so that that's not the only option to bring in an income, and look at other ways of creating an environment where other businesses can flourish.
I guess when we talk about those illegal outlets, that also speaks to policing, because if we had law enforcement, we actually wouldn't have those illegal places opened. Let's take a few more calls. If you're just joining us, it is the second hour of Inside EWN, Inside Eyewitness News. My name is Mahlatse Mahlase. We are asking if we need more laws to control our bad drinking habits that have dire social consequences, from road fatalities to gender-based violence, interpersonal violence, etc. Let me take this call from Basil in Boksburg. And you are saying that alcohol does not contribute as much to the economy as we think. Basil, I mean, in that regard, do you think we should just then ban it?
No, not ban it. So mine is that maybe my point of departure should be saying we don't need much law. It's just the implementation of the current laws that will help us. So my argument is this, Mahlase. The alcohol, it's not as much contributing to the economy. And my basis for that is to say, as much as it can contribute billions on the right-hand side, on the left-hand side, it's taking more billions in terms of the accidents which are caused, in terms of road accidents, and we have to pay the road accident funds, the hospital bills that people are injured while they were drinking, and so forth and so forth. So it goes on and on and on. Socio-economic issues, people die and stuff like that. So, which creates more problems, breadwinners being taken away after these drinking sprees. So for me, as much as it's giving, it's taking on the other side. And in fact, it's not even taking, it's bleeding the economy, because when you look at the hospital bills, we are told by the very expert that the most trauma units, it's because of this alcohol drinking. And I don't think the alcohol people themselves, I mean, the people that are selling, they're going to come up with solutions. You know, I can hear to what your, as a parting shot, what your guest is saying.
Let's wrap it up, yes.
that they're gonna not sell to people that are already drunk and so forth. That's not gonna happen. It's not gonna happen. In a business of making money, it's just not going to happen. When someone brings money, they're gonna take it.
That's Basil there from Boksburg, who doesn't believe that the industry will actually help in the scourge. We lost Advocate Msibi earlier. Just to bring you in, Advocate Msibi, I'm just wondering if you are having conversations with law enforcement, because while you're proposing these laws, a lot of our listeners are asking who is actually going to police them. One of the things that they're saying is that you look and in some towns, there's just no cops or municipal police on our roads. Is this just a law issue, or are you actually talking to your colleagues in government to ensure that these laws are implemented?
I lost you at the time when one of the callers had indicated that I haven't answered that question. Let's get deeper into that question. I'll give the figures. In terms of the traffic law enforcement, in this country, we have 20,000 traffic law enforcers, okay? We have 12 million licensed drivers. We have 12.5 million records. And I'm bringing this into the discussion for all of us to appreciate that we'll never have sufficient law enforcers.
But we have only less than not all of South Africans drink, so it's a very small population of drinkers, and worse, those that are actually on our roads drunk and being irresponsible.
I'm giving you the figures so that I'm bringing this point home. It's not only law enforcement that should deal with this issue. We all equally have education, but we need to have to educate our citizens as well as the road users, so that all of us take responsibility. It cannot only be government that is taking charge of this matter. I will show the analysis, and with other countries. You go to Sweden. Sweden has the lowest of the fatalities, and yet they don't have so many traffic law enforcers and the police that are policing the public. But it is within the education point of view, because every citizen has a responsibility to ensure that any other road user is safe, and nobody gets into this quagmire through my irresponsible...
Let me challenge you on that Sweden example, because as one of our those watching us on Facebook is saying, is that we have these first world laws in a third world country. Part of it is that in South Africa, we don't have a public transport system in the evening. There's none to actually speak of. And in Sweden, people can actually catch an underground bus or catch a bus, and they can actually afford taxis. In this country, we actually can't. And again, it begs that question around, should we not be working at enforcing the current laws as opposed to now going and finding new laws that we actually can't implement?
Not exactly. Not exactly. For instance, in South Africa, we have gone a long way to give the alternatives for those people that will have, of course, consumed liquor and not to drive, because you can have the Uber, you can have the taxifier, you can ask a friend to drive you. It is sheer irresponsibility for somebody who has taken up liquor and still drives. You know, Mahlatse, that is equivalent to a person who is then taking a firearm, load it fully, and put one up and give it to a child.
While we all agree with you, Dr. Msibi, I think Advocate Msibi, the question has really been around, are we enforcing those laws? As we wrap up, I'm going to take 2 calls and just be short. Jeremiah, you are saying we need a bottom-up approach. Quick one.
What I'm really hearing what the gentleman there just spoke. Apologies, I forgot his name. But really, the challenge that we're facing with, we have so many different strategies in South Africa. We have so many different ideas. We talk about NDR, we talk about this, and we talk about that. But if you really look at this thing, there is no one single strategy that says, as a country, in 20 years' time, this is the kind of society we want to have. Now, I am a former club owner, and I can tell you, you can go to a high school tomorrow or a primary school tomorrow. Alcohol is something that is fashionable. It's something that young kids want to get into alcohol. Why are we not teaching our young people the dangers of alcohol? Then you don't have to tell this person by the time he's 21 years old, he understands the dangers of alcohol. He understands that if I drink alcohol and I get intoxicated, this is what it does to my body. And therefore, then these are the dangers that I can actually put other people. Now we have different people coming in and saying, this is what you must be. But those are very reactive. And number one. And number two is they are very much...
I have to cut you there. Sorry, Jeremiah. But Jeremiah raising an important point there around educating our young people. I'm going to give you my panelists, just 30 seconds each to wrap up. And I'm going to start with you, Dr. Malebo. Mashaba, what should be the way forward? 30 seconds.
For me, I think it's very important that the Ministry of Transport need to also liaise with the Ministry of Social Development. I think also to ensure that proper programs are put into place for education, for prevention as well, because punitive measures, as I said, they will not take us anywhere, because this is something that needs to be uprooted right from the bottom. So I think we need to focus more on social programs to try and do early intervention,
as opposed to new laws. Dr. Mashaba there. Let me give you to you, Kurt. As we wrap up, what should be the way forward?
I think the way forward is, as I said earlier, government, industry, civil society get together and find some solutions to our problems. I think as South Africa, that's how we got our democracy. We sat down and discussed a way to find a solution jointly. And I think that's the way forward. Education, I heard some of your listeners talking about education and awareness. Yes, that's got to be part of the solution.
Thank you very much. And to you, Advocate Msibi, I know we lost you there in part of the conversation, but unfortunately I've got just under a minute, so I'm going to also give you 30 seconds to wrap up.
Well, we need stricter laws. We need to be very vigilant on this matter, but we also need partnership with the communities, for the communities to take the responsibility of ensuring that we act responsibly. We need to deal with the issue of education. And this education, as we have attempted in the department, to have it in the curricula of the school so that kids from the tender age understand the ills and how to be responsible on our roads. But above all, we also need to deal with the social ills.
Thank you very much. That was Makhosini, Advocate Makhosini Msibi, who's the CEO of the Road Traffic Management Corporation. Also joining him there in that panel is Kurt Moore, who's the CEO of South African Liquor Brand Owners Association, and Dr. Malebo Mashaba, clinical psychologist and managing director of Mashaba Wellness Consultancy. And that was the roundtable discussion from Inside Eyewitness News. My name is Mahlatse Mahlase. We'll join you again next Sunday, 7 until 9 p.m. It's 9 o'clock and it's time for Eyewitness News.
This is Eyewitness News.